The situation is such that there are obvious bed shortages at the GHA at the minute. That's one of the issues that we highlighted within the PR. But the other one, of course, are the cancellations that have been seemingly occurring recently. And that obviously comes from the experiences of people, of patients who have expressed these things to us. It appears to be that there were issues in respect of the unit which sterilizes the equipment for these surgeries to take place at the GHA. And what appears to have happened is that there was a great staff shortage on at least one particular day. We believe it's an example of the culmination of many issues which we've been speaking about for some time now. And of course, we saw it from the recent demonstration outside number 6 by healthcare workers. And the issues were laid out very cleanly and very clearly by them. And these issues are the ones that have culminated in what we've now seen, which is the cancellation of many surgeries.
The Minister did tell Parliament quite recently that cancellation rates have halved. So what would your response be to that?
So as part of that comment that the Minister made, she also said that cancellations or elective surgery cancellations were a thing of the past. It's clear that they are not a thing of the past, that this still occurs. And I can appreciate that the specific instance we're talking about is very much to do with the staff shortage issue as well, amongst other issues. And we're hearing and we've seen from the staff who have demonstrated and who have taken industrial action in past months. Talking about staff burnout, the fact that there are not enough individuals within the different departments to take up the roles that are necessary to keep the hospital functioning at the level that it needs to. And also we've heard that vacancies aren't being filled quickly enough. That's a problem, and it's a problem that Unite has highlighted in past months, and it's a problem that's very much coming to light now.
So how do you think that the issues could potentially be alleviated?
So we hear a lot from the government saying that we've got full complements, and this issue in particular shows that the complements are not as full. They don't have the resilience that's necessary in order for the hospital to function in the manner that it needs to function. And so it's things like listening to the staff on the ground, which we've been saying again for a very long time, and which the staff themselves have been highlighting. The mixed skill review as well, which my understanding of a mixed skill review is that a review is undertaken of the resources the hospital has, the human resources the hospital has available to it, and where the gaps are. And if that review is not concluded in a timely manner and responded to satisfactorily, then again the issues are not resolved. So that needs to conclude quickly, because there hasn't been one for some years now at the GHA. We do talk about spending, and we've just had the budget, and we're often accused of saying that we say that they should spend less. We don't say that they should spend less, particularly on health. What we say is that the spending should be where it is necessary. And we've just had an auditor's report that's been very damning of some areas, and perhaps if that expenditure were to be going into things like this, like extra staffing, extra complement within certain departments, we wouldn't be seeing the issues that we're seeing now at the GHA.